Hi, everyone. Welcome to BioWave's 7th webinar. My name is Brad Siff. I'm the founder and president of BioWave. And this webinar is going to be on the topic of pain treatment applications using our FootAnkle BioWraps. At the end of the session, we will have a live Q&A session. Please look for the Q&A tab in the middle bottom of your screen and submit your questions that way. We hope you enjoy this webinar. So this presentation is going to cover our FootAnkle BioWrap, which is a wearable compression electrode garment. Maybe one of the biggest clinical advantages of using this technology is that it can provide over 6 times the treatment area. We treat over 6 times the volume of tissue as compared to a conventional 2-inch diameter round electrode. We use this advanced silver fabric electrode technology. It's a circumferential electrode, so we treat completely around just proximal to the ankle, and we treat completely around the entire metatarsal region of the foot. The device is providing compression simultaneously while allowing the delivery of our high-frequency neurostimulation technology into deep tissue. There's no guesswork as to where the electrodes are placed because they're fixed within the device. This is a reusable device. It's guaranteed for 1 year, and it's easily cleaned. This device can be used with our BioWave Pro neurostimulator, which is typically used in clinics, hospitals, and athletic training rooms. And it can also be used with our BioWave Home prescription neurostimulator. The BioWrap comes in 2 different sizes, a small, medium, and a large, extra large. In the small, medium can fit women's feet from size 6 to size 10, men's feet from size 5 to size 9. The LXL size fits women from size 11 to 16 and fits men from size 10 to 15. This design can be used on either the right foot and ankle or the left foot and ankle. The construction of this device, on the left we have an inside view, and on the right we have an outside view. On the inside, you can see we have a circumferential electrode that encompasses the entire region just proximal to where the ankle is located, so we can treat completely around that region of the lower limb, the lower leg. And then the lower circumferential electrode encompasses the tarsal and the metatarsal region of the foot. The heel sits back in this region here where there's a hole, and the foot comes across the bottom electrode where the icon indicates. On the outside, these are the compression straps, and there's 2 Velcro attachments, 1 for each strap. And we have 2 4-inch snap cables. These cables provide the electrical connection from the silver fabric electrodes to our lead wire cable that goes with either our BioWave Home or BioWave Pro device. Because of the design and construction of this electrode compression garment, it allows us to target most of the nerves running through the ankle and into the foot. And this includes the tibial nerve, the medial and lateral plantar nerves, the deep and superficial perineal nerves, the intermediate dorsal cutaneous nerve, and also the saphenous nerve. So it really does not matter what's causing the pain condition to occur. What's important is that the electrical field forms deep enough along that entire circumference of where the two electrodes are. And if that electrical field that we create, the active field that we create in deep tissue in the body, can encompass those nerves that are conducting the pain signals to the brain, then there's a high probability that this technology can help reduce pain for that patient. So there are many different potential pain conditions that can be treated using this device. And you should think of this device as a first course therapy for treating both nociceptive pain conditions as well as neuropathic pain conditions. So one of the biggest applications where we've seen excellent success with patients is treating painful diabetic neuropathy. And so where a patient has a dull thudding or burning pain throughout the ankle area and the entire foot, when you attach our high frequency stimulation to this device, the patient feels like the entire region from just proximal to the ankle down to the toes is being stimulated. It feels like the entire foot and ankle are being stimulated. And so it's a very useful treatment for patients that are suffering from PDN. We've also had success treating patients who have pain that results from Morton's neuroma, from plantar fasciitis. The circumferential electrode around the foot is right over the location of the plantar fascia, often where the pain presents. This device is really ideal for pain that results from ankle and foot sprains, whether it's a low sprain or a high sprain, as well as from tendinopathies. For example, from Achilles tendonitis, we're capturing the proximal end of the Achilles tendon. And so if that's where the pain's presenting, we can get good treatment along the Achilles tendon there. For metatarsal pain or pain over the tarsal area, or over where the cuneiform and cuboid bones are located, if there's pain in that region, that lower electrode, circumferential electrode, is really encompassing that entire region. And so similarly, you're able to get pain relief from a transverse tarsal or tarso-metatarsal joint pain condition. So we're really capturing such a large volume of tissue throughout, as I said, just proximal to the ankle and through the entire foot, that this is a very useful tool as a first course therapy for helping your patients. So let's talk about some of the pro tips for applying this device. And it's important to take you through this to make sure that your patient is going to get optimal results from using it. So first and foremost, in order to allow our devices to deliver the high frequency nerve stimulation through these much larger electrode areas, we have to place a conductive cream and just a pea-size amount, one pea-size amount for each of the electrodes, has to be rubbed into the skin. So you have to rub in completely around the entire region just proximal to the ankle and completely around the tarsal and metatarsal area of the foot. It's okay if the cream spreads beyond the region where the silver fabric touches, as long as we're getting the entire top, around, bottom of the foot, and all the way around just above the ankle area. So you want to rub it in. You don't want a huge amount of white cream staying at the surface. So that's very important because that's going to enable this device to work properly. Both 4-inch snap cables that I pointed out before will already be snapped into the snaps, one up on the upper electrode, one on the lower electrode. So just confirm that they're already there and attached. Then you can attach your BioWave lead wire cables from your BioWave home device or BioWave Pro device to the two blue prong connectors. You want to place your heel back into the hole and step across the bottom electrode as shown in this second diagram. In the third diagram, now we're going to start with the top electrode. We're going to take that compression strap, pull it through the D-ring, and pull it so you've got tight but comfortable compression on the upper circumferential electrode. Then you're going to pull it tight and back around the front of the ankle and then across the back, again, just proximal to the ankle, and secure it with Velcro somewhere on the back side. Now we're going to repeat that process for the lower strap. And you're going to pull it through the D-ring, pull it tight. It's very important to make sure that there's no gaps that are occurring anywhere along the perimeter of that electrode. That goes for the upper electrode as well. Then you're going to pull that compression strap back across the front of the foot and secure it tight with the Velcro strap. So when you're all done, again, check to make sure there are no gaps anywhere. It tends to occur more on the edges of the foot and sometimes the edges just proximal to the ankle. We want to make sure there's good conduction between the silver fabric and the skin throughout the entire circumference of the foot, or the circumference just proximal to the ankle. So couple troubleshooting tips. So if there's a connection error, your device will show, as in this image here, 2 pads with an arrow to the body. The pads to the body error icon basically is telling you, hey, the device doesn't see the pads on the body, even though you're all hooked up. The device is hooked up to the cable to the BioWrap to the foot. So if you see this error condition, it means one of 2 things. Either the skin impedance is too high or the skin impedance is too low. So if the skin impedance is too high, it may be because the foot is very calloused on the bottom, and perhaps maybe you forgot to apply conductive cream to the skin, or you didn't apply enough conductive cream because the skin is so calloused, and so the device just can't see the attachment, the conduction between the silver fabric and the skin, because the resistance or the impedance is too high. So in that case, you need to remove the BioWrap, clean the skin thoroughly with soap and water. If there's hair, more likely around the area of the ankle or just above the ankle, you should shave that location, and then apply the BioWave conductive cream all the way around both locations, and then reattach the BioWrap and restart the treatment. And that will correct this error condition that you see. On the other hand, if you applied too much conductive cream and there was a lot of white cream still on the surface of the skin, and then you put the BioWraps on, it may be that the skin impedance is too low and the device isn't going to see the electrodes because the impedance is so low. So in that case, remove the BioWrap, take a dry towel, clean the excess cream off of the skin, and clean any excess cream off of the silver fabric on the BioWrap. Then reattach the BioWrap and then restart the treatment. So there's one other, this is less of a troubleshooting and more of kind of a pro tip. And let's say that you're all connected and it's working, but the sensation that the sensation that the patient feels is stronger under one electrode versus the other. So you have 2 variables here for controlling the sensation on either of those 2 electrodes relative to one another. So the 2 variables are compression and the amount of conductive cream you use. So the tighter the compression and/or the more conductive cream that you use, the stronger the treatment sensation. The less compression, the looser the BioWrap, and/or less conductive cream will mean less of a sensation. So let's say it feels much stronger around just proximal to the ankle versus how it feels around the foot. In that case, you could loosen the compression on the ankle to make it feel less strong. This is if you want it to feel stronger on the foot relative to the ankle. You could also remove the BioWrap, add more cream around the foot, then put the BioWrap back on, see how it feels. If the ankle still feels stronger, just make the compression tighter on the foot and less tight on the ankle. So those are the two variables you have to adjust the sensation in both those locations to either make one stronger versus the other, or to make them feel the same, depending upon whether you're trying to treat the entire foot and ankle, or you want to be more focused on the foot, or more focused on the ankle. And this is the conductive cream, this image here that comes with your BioWrap. The treatment protocol, it's a 30-minute duration treatment, as are all BioWave devices. And we recommend typically with this device 2 to 3 treatments per day, separated by at least 30 minutes in between treatments. So you want to let the body come back to a normal state before you hit it again with another treatment. It doesn't have to be exactly 30 minutes. If a patient wants to treat one time in the morning, one time midday, and treat at night before they go to sleep because it'll help them sleep better, it's whatever the patient needs. So basically, the patient should treat themselves on an as-needed basis. There's no limit to the number of treatments you can do per day. There's no harm in doing more treatments. If a patient's having a bad pain episode day, they can do 5 or 6 treatments, whatever's required to be able to manage their pain. But in a normal treatment course, usually patients will use it 2 to 3 times a day. Both doctors and patients report that there's a cumulative benefit with multiple treatments. So when you first start out, we'd recommend doing, say, 3 treatments, each one separated by 30 minutes. So you're kind of hitting that region hard, and that will really begin the effectiveness and the pain relief. And then, you could do that daily, or, and after several days, you can move instead of from 3 treatments to 2 treatments, or from 2 treatments to 1 treatment. Again, but you use it as needed, as I described. The contraindications for this device are you cannot use it if you have an implanted cardiac pacemaker. There's no negative data, and even though the treatment is located very far away from where the pacemaker is located, the FDA requires us to contraindicate it for those types of patients. The silver fabric electrodes must be placed over intact skin. So you cannot use this electrode compression garment if the silver fabric is going to be over open wounds, broken skin, very rashy skin, or sensitive skin areas like sunburned skin. Please note, though, that BioWraps can be used directly over or in the proximity of any type of implanted or orthopedic hardware, metal hardware. So that includes total joint replacement, anchors, plates, rods, screws, pins, or clips. As long as those devices are not piercing the surface of the skin, if they're implanted, you can use this device on your foot and ankle over those types of implanted metal hardware devices. In terms of cleaning, you can clean the silver fabric on these electrodes using a Purell brand hand sanitizing wipe. So any type of sanitizing wipe that can be used on the skin can be used on the silver fabric. The best way to wash these is to hand wash them using mild soap. Please disconnect the 2 4-inch snap cables from their snaps and before you hand wash the BioWrap. You can fill up a sink and put in a little mild soap. You can rub the soapy water on the silver fabric, on the neoprene sections of the BioWrap, rinse it under the water, and then place it on a flat towel to air dry. That's the best way to clean it. You do not have to clean it after each use, maybe once a week, once every 2 weeks at most. You know, it depends on usage and how clean your skin is. So do not wash this in a washing machine. Please do not place it in a dryer, and do not dry clean it. Dry cleaning it will destroy the BioWrap. The others will significantly limit the life of the BioWrap. So thank you very much for attending our webinar. As I mentioned earlier, please submit your questions under the Q&A tab in the bottom middle of your window. And if you have further questions after the webinar, please contact us. Our information is listed below. So thank you, everybody, for attending this webinar. If you have any questions at all, please submit them through the Q&A tab on the bottom. Okay, I see. There's one question on painful diabetic neuropathy and just trying to gain a better understanding of the use of the FootAnkle BioWrap for that. My comment is similar basically to what I said during the webinar. When you treat with the FootAnkle BioWrap, you're capturing all of the nerves running through just proximal to the ankle, as well as all of the nerves in and around the foot. And so when you stimulate the entire foot and ankle using the BioWrap, the entire foot and ankle right down through the toes feels like it's being stimulated. And because generally speaking, pain that results from diabetic neuropathy is kind of a dull thudding pain, kind of a burning sensation around the ankle and around the entire foot. This makes the FootAnkle BioWrap an ideal tool for treating this painful condition. There really is nothing else like it on the market at all. In fact, we have a very strong pending patent application on all of our silver fabric BioWraps. So anyway, you know, we would highly recommend using this as a first course therapy to treat painful diabetic neuropathy, and hopefully you can, as a provider, you're interested in trying this. And if we have any salespeople on, you know, please encourage providers to consider using this. Any other questions from anybody in the audience? Okay, here's another question. Is it damaging to the electrode pad if it extends throughout the D-ring when tightening, or will size prevent that? It's a good question. I mean, the sizes described are fairly accurate, you know, whether someone should be using a small, medium, or large, extra large. If someone's right on the border and they end up using an LXL size, and when they pull it tight, because they may have a longer foot, but the circumference of the foot isn't quite as big, it's possible some of that silver fabric might pull through when you're trying to tighten it. That will not harm the BioWrap. It's okay to do that. Just be gentle as you're pulling it through and wrapping the compression strap around and securing it with the Velcro strap. But for most patients, if they're using the correct size, that silver fabric strap, the silver fabric electrode should come right up to the edge of where the D-ring is, and you should have tight enough compression to prevent any gaps from occurring anywhere around the perimeter of the foot or anywhere around the perimeter of the ankle. I hope that's helpful. Any other questions from anybody out in the audience? All right. Well, thank you very much for joining our webinar. If anyone does have a question, feel free to reach out to me directly at brad.siff@biowave.com. Thank you very much. And we look forward to seeing you at our webinar next month. Take care. Bye-bye.